There are many different holds that the staff at the hospital can show you, and we will review a few of them here. Every mother and baby has different needs and preferences, so experiment to find the one that's best for you. Remember that good positioning always starts with getting yourself in a comfortable position. Use pillows, and remember to always bring the baby to you instead of bringing yourself to the baby. There are 4 positions that we will demonstrate in the hospital to help position the baby and to get the baby latched on correctly and comfortably. The cross cradle hold works well for small babies or those that have had a hard time latching on. Start by placing a pillow on your lap to support the baby in a semi-reclined position. Choose the side you're going to start on and aim the baby's head in that direction. Turn the baby tummy to tummy, because if you've ever turned your head to the side and tried to swallow, it's difficult, so tummy to tummy is always best. Now support the baby's body in your forearm and use the hand that's on the same arm that's supporting the baby to hold the baby's head. This keeps your other hand totally free and available to manipulate the breast and latch your baby on. Now tip the baby's head back into a drinking or sniffing position with the baby's mouth at the level of your nipple. The football hold is a favorite of many mothers because babies seem to latch pretty well in this position. It's also preferred for women who have had a C-section because it doesn't put added pressure on your incision, or for mothers who have twins because they can latch 2 babies on at once in this position. Start by placing pillows at your side and behind your back. Then lay the baby on the pillow perpendicular to your body. Support the baby's body in your forearm and head in your hand, tucking the baby's legs between your arm and body, like you are carrying a football. The side-lying position is another good option for mothers who have had a C-section because it keeps your baby off of your incision. Lay down on your side and set your baby next to you, tummy to tummy. Use pillows to support your back if desired. Support your baby's head in your hand. When it comes time to switch sides, hold your baby close to your chest and roll onto your other side. The cradle hold works well for mothers and babies once breastfeeding is well established. Make sure that you have good back support and use pillows or armrests to raise your baby to the level of the breast. Lay your baby across your lap, tummy to tummy, and support your baby in the arm on the same side of the breast that your baby is nursing from. Your baby's ear, shoulder, and hip should all be in one straight line. One important part of positioning, no matter what hold you're using, is nose position. Make sure that your baby's nostrils are always free and clear. They're nose breathers and can have a hard time breathing if they become smothered by breast tissue. If you notice that your baby's nostrils are obstructed, reposition your baby. For example, if you're holding your baby in the cross cradle hold, gently push your baby a little bit closer to your armpit, and that should clear the baby's airway. In the beginning, expect to have to hold your baby onto the breast at all times, and be ready for them to rear their head back during a feeding. A gentle hand on their head will help to prevent them from quickly pulling off, which can cause you pain. The first few feedings will feel awkward. It's a new sensation for you, and the positions will feel awkward. It's definitely worth the effort though, because there are so many health benefits for you and your baby. Be sure to talk to your nurse or lactation specialist if you have more questions about positioning.